The next test is the piriformis test. To know about the piriformis test, it's very important. You need to know the biomechanics of the muscle. So in normal hip joint, where if the hip joint is in 0 degree of flexion, so it acts as an external rotator. So whenever I walk, it acts as an external rotator of the hip. But as soon as I flex the hip beyond 90 degree, it acts as a medial rotator of the hip. So it medially rotates. Can you do the medial rotation, please? So it medially rotates the hip. So now, to stretch this muscle, you can do it in two different ways. One, beyond 90 degree you can do a stretching, and below 90 degree you can do a stretching. So let us take beyond 90 degree what kind of stretching is. So for this, you flex the hip. So you know it is a medial rotator beyond 90 degree. So to stretch this muscle, what you do is you do a lateral rotation, adduction, and bring this knee towards the opposite shoulder. So bring this in this position. So this will cause a stretch in the piriformis at the bottom of the hip. So it's also very important that you need to stabilize the pelvis as well. So you need to stabilize the pelvis. This stretches the muscle. If you have symptoms, then the test is positive for piriformis. The other test is when the test can also be done below 90 degree. The best position is 60 degree of hip flexion. So we know that when the hip is below 90 degree, so the piriformis works as a lateral rotators. So for this, what you do, you adduct the hip and medially rotate the hip. So whenever you do a medial rotation and adduction of the hip in this position, this will stretch the piriformis as well. So you can do the stretching at two different occasions. So about 50% of the people will have the sciatic nerve run through the piriformis muscle. So whenever you have the piriformis tightness, this can compress the sciatic nerve, and you may have the symptom of sciatic nerve.